If a person can begin to understand what triggers their symptoms, they may be able to take steps to control their anxiety and minimize the effect it has on their quality of life. So the treatments for emesophobia, and this is what they do say, there is with no definitive causes to be found, it stands to reason that many treatments options can be limited as well. However, treating the anxiety that results from being criticized or worrying about committing sinful acts is often the first line of defense. Other psychiatric medications may be tried as well as an attempt to fight depression and maintain feelings of general wellness. The trouble is with the type of medications used will depend on whether or not the patient has any other mental health that they are being treated for. Also, trouble is with too much medication, it masks the issues but doesn't get to the deep down issues to resolve them. So exposure therapy is probably one of the things which you can do mainly in physical therapies. Obviously, because I mainly work online, it's a little bit difficult, but if I was in person, I would be able to do that. So exposure therapy may be beneficial if performed so that the patient can see the benefits of criticism being offered. Using constructive criticism that offers a teaching lesson allows the patients to find ways to improve their methods instead of just pointing out what's wrong and leaving them to figure it out on their own. This is actually one of the things you have to work very much if you are a school teacher as well. You must give constructive criticism. You actually are taught this very much in your teacher training. Constructive criticism is useful. Don't just criticize, give constructive criticism and actually explain that what the things were good, what they can improve on. It's actually you always are taught to give 3 positive and 1 constructive criticism. That's what you literally are taught. So if people actually use that in real life, it's very useful. And this may not be the best method for everyone, but it does allow the person to gradually get used to criticism in their own way and in their own time. Now, I would use mainly, as a therapist, I would use cognitive behavior therapy or CBT. This is beneficial as it helps to uncover the reasons for a person's behavior. If the cause of their behavior and irrational fears can be addressed, it will allow them to alter their thought patterns so they are more positive and constructive in their nature. And CBT can effectively be used in conjunction with exposure therapy to help patients realign their thought patterns so they are not so irrational. This type of therapy may be able to improve their quality of life and help them begin to function somewhat normally within society. And this is what it is that you actually have got to always look at it. This can take time. If someone's been in trauma for so many years, say they've been in trauma for 40 years of their life, some of them get very impatient and they want it all done within a week or 2 sessions. That just cannot happen. You've got to go through all different things to not everything over 30, 40 years, obviously, but you've got to use the ideas of how to help that. Now, as a form of exercise that strengthens the body and mind, a recommendation I would do is yoga. And a lot of yoga doesn't always have to be about just doing the asanas. It can also be going into breath work and pranayama, which I'll explain in a minute. But yoga improves the person's ability to focus and maintain a relaxed state, even during the most stressful situation. And although it's not seen as a cure, it can be used as an effective coping mechanism that will allow a person to maintain physically and psychological control of their bodies and mind.